Good morning, everyone. Good morning, boys and girls, all across the School District of Osceola County. My name is Chris, and this is Aaron from Career and Technical Education in the School District of Osceola County, bringing you another virtual tour in the imaging department of Celebration Hospital. I'm going to turn it over to Aaron on our 360 camera, and she's going to talk to you and introduce to you our guest, Robin, about what she does here at the imaging department. Aaron?
Thanks, students. So we are in season 2, episode 1 of our VirtuLIVE, and we're excited today. Obviously, you can see that I'm a patient today, and in imaging department, and there are many different things that happen in the imaging department. But what I want you to understand for today is that this career path has many different journeys, and today Robin is going to talk to us a little bit about her background, how she got here to working. And at the same time, she's going to show us about this cool machine and what she's actually doing to me today. Robin.
Thank you. So my name is Robin, and I'm a diagnostic medical sonographer, which is basically just a fancy way of saying I do ultrasound for a living. I got here by kind of a crazy way. I have 2 degrees in art. I have 1 bachelor's degree from Virginia Commonwealth University in fine arts. I also have a degree in photojournalism from Brooks Institute of Photography. And then after that, I decided to go into the medical field, and I earned my degree in sonography at Kaiser University in Fort Myers, Florida. And I graduated in 2016.
Robin, wow, that is an interesting path. So no one thinks that they're going to go to college, they're going to come out with these fantastic degrees in the art field and then end up in healthcare. How did you make that decision?
I knew I wanted to help people, and my photography background actually correlates really well with the imaging that I do here with ultrasound.
Yeah, that absolutely makes sense.
So it was a smooth transition.
Great. So how long did it take you in your program for just the ultrasound piece?
Kaiser is an accelerated program, so it was 16 months, but that's all you did all year round. You just went to school the whole time.
So if I started out in high school and went on to college, and I didn't have a bachelor's degree, how long typically does it take someone to get this certificate in order to be able to work?
My prerequisites took about maybe a year to a year and a half. And then following that, the 16-month program. Most programs are typically 2 years.
Okay. All right. Well, thanks so much. So can you tell us about what you're doing today?
So right now I'm looking at your abdomen, which is one of the studies that we perform here at Celebration. Right here we have your pancreas, and then above it we have your liver, and then here's your right kidney.
Wow.
Now, I have a question. I'm a little untrained as to exactly what I'm looking at. How can you tell the difference between a pancreas and a liver and a kidney? Are there any visual clues that tell you that?
Well, taking anatomy and physiology as a prerequisite really helped me to understand basic human anatomy. And I will have to say that when I was first learning how to do ultrasound, looking at the pancreas was one of the hardest things possible because I just couldn't see it. It just takes time and practice being able to differentiate the different tissue textures and grayscale colors and like markers that you would see with each part of the anatomy.
So is there anything special about, like, if I see it's completely black circles there, what is that telling you? Where you have these black markers right there, is that like air pockets or pieces of tissue, or what are all those?
That's actually just part of her anatomy. This black pocket right here is her gallbladder.
Oh.
Oh, that is cool.
And then the other ones that you're seeing are just her vessels.
Okay.
Yeah. So here we have her inferior vena cava, which is what brings the deoxygenated blood back up to the heart. Here is your aorta, which pumps the oxygenated blood throughout your body to your muscles and organs.
Wow, that's really cool.
I can definitely understand where having a photography background would be really helpful.
Quite, yeah.
You can see
where I was just trying to see if you could actually see the blood flowing.
Sure.
Whoa.
And then that's the pulse of your aorta.
Cool.
Very cool.
Love that. So I do also know too that you are a diagnostician, meaning that doctors send you orders on specific things that they want you to look for, but you're not diagnosing anything. You're just giving them the information that you obtained from this. Is that correct?
Correct. So what our goal is to evaluate whatever the doctor wants us to evaluate, be it the pelvic area, your abdomen, a baby brain or spine, something like that. And we just look for abnormalities and then notate them on our images. And then following that, we fill out a worksheet and submit that to the radiologist. The radiologist will review our images and they'll be the one to decide whether or not something is normal or not normal.
Great. If you had to give one bit of advice for someone who wants to go into this field, what would it be?
Study hard and don't give up, because everybody cried a lot in my program. I think one person cried at least every single day. It was incredibly challenging and taxing, but it's a very rewarding field to be in.
Awesome. Well,
Yeah.
thanks so much for sharing your time today and
My pleasure.
ultrasounding my abdomen.
Yeah, of course.
Everything looks okay to me.
All right, thanks guys.
Thank you,
All right,
Robin. I
bye-bye.
appreciate it.
Alright, hey, welcome back. We are now in a different area of the imaging department. We're in a room where it is called the CT scan. I'm here with our guest, Thomas. Thomas, can you tell us a little bit about what your role has been here at Advent Health Celebration and how did you get here?
Sure, of course. Hi guys, Thomas here. So my story is a little bit different than some others, which you may be finding through these programs, but I'm actually from Oklahoma. I currently am the clinical imaging supervisor for CT, or computed tomography, and nuclear medicine. What I did actually was, I have a bachelor's in medical imaging and radiation sciences from the University of Oklahoma. Now, obviously, again, that's a different path than what you may have heard from other associates or other technologists, where some actually just went through and got their associates, which is a 2-year degree. I went a little bit longer, for 4 years, just so I can maybe expand my horizons with maybe some leadership in imaging, which kind of landed me where I am today.
Great, so let me make sure I understand what you said, Thomas. So in order to be a technologist, to be able to work with a machine like this with patients, you could do a 2-year program right out of high school and be done. But you decided to take the path of getting a bachelor's degree so you can get more leadership skills, be more specialized, and that could lead to greater and better jobs. So you decided to take that path.
Correct, yes. So I am a radiology technologist at heart. And what I did was just did some extra training, some more clinical hours in the hospital, and took a test, and that actually got me registered in computed tomography. So I have a registry in CT, or computed tomography, but as well I can also perform x-rays, and that's kind of my base, my home, if you will.
So what are some of the common things of why a person would need a CT scan? Why would they be coming to your department to do this particular type of test?
Sure, so we use CT for quite a bit. We use it in a trauma situation, maybe where someone has gotten hurt, and so we look for broken bones. It's actually used quite a bit for the detection of cancer or certain illnesses or diseases. And also we use it in an interesting facet with radiologists. So the radiologists that we work with are called Interventional Radiologists. And what they are doing is maybe taking little specimens and sending them off to a lab to see whether they're cancerous or not. And we just kind of help the radiologists during those procedures. So.
Great. So this machine is here. Like, how many is Advent Health
So we have 3 CT machines. We have one here, we have one just right across the room, and then we have one upstairs. So we have a total of 3. They're all essentially actually different. This one we utilize a lot for what we call CCTAs, which is essentially just a look at the heart. So we look at the vessels in the heart. We give contrast with this guy right here, which is a contrast injector. So we inject contrast, which is just a fluid, into an IV that we may start or that the patient comes to CT scan with. And we're able to take pictures of the heart. That's a major use for this particular machine, as well as other ones. They all essentially function the same way. This is just the one that we use for heart scans. We use the one upstairs, one of the scans for biopsies and a lot of outpatient exams, patients coming in from outside the facility. So we have a good fleet here. We have 3 CT scans, and we utilize them quite a bit.
So if a patient comes in, the doctor says that there's imaging that needs to happen of the patient's heart, they would come to you. So your job would be to put in an IV, make sure that that is done properly, and then they're placed onto this table, I'm assuming here,
Absolutely.
right? And do they move inside of the machine?
Yes. So as you mentioned, the patient may come over with an IV, or we are also trained in CT or computed tomography to insert the IV. We also work a lot with nurses for this particular exam. The nurse may give the patient some medication to slow their heart rate down, because we're taking pictures of the heart, and we all know the heart is beating, and so we want to slow the heart rate down just a little bit safely. That way we can take some pictures of it.
Oh, that makes sense. So that you slow it down a little bit, because just like if you move your camera too fast, the images would have to be blurry.
Exactly. So that's how you notice motion on a CT scan. Is you'll notice a little bit of blurriness. So and that's kind of what the special thing about this machine is it images very fast. You can take a CT scan of the heart in less than a second with this particular machine. So that's why we utilize this one quite a bit. As Aaron mentioned, it does move up and down. It goes in and out. It talks to the patient. We have several different languages, from Arabic to Mandarin to English to Spanish.
So what are the things that the machine would tell a patient, like calm down, don't move, you're okay?
Yep, just as motion. We mentioned a lot about motion. The patients obviously are also breathing. So the heart's beating, they're breathing. So we want to make sure that they're not breathing during the scanning portion of the exam. So the machine will talk to them and tell them to take in a breath and hold it. It'll tell them sometimes to do not swallow or do not breathe. It's just to kind of help mitigate or try to make sure that the patient's not moving the best that we can.
And this is the control room, is that correct? So this is where they would actually be watching the patient and watching the images and making sure they're getting the right pictures.
Exactly, yes. So this machine, we use radiation. There's no radiation on right now, but once we start the exam, radiation is administered. And we do, to protect ourselves, we as technologists will function out of work out of the control room. There's just the patient is in the room. We do have medical dosimeters.
What is that called again?
It's a medical dosimeter, so it's just monitoring our exposure to radiation. So what we do is we turn this little doodad in every quarter, so every 3 months, and they monitor the radiation for us to make sure that we're not getting too much.
Have you ever been concerned before where your dosimeter was?
No, not in
It's
CT.
very minimal exposure.
Correct. Now, out of all the modalities, we do use quite a bit of radiation for a CT scan, but obviously we have what we call ALARA, which you may hear a lot in radiology. It just means as low as reasonably achievable, meaning we don't want to just hand out radiation. We want to do it safely, as well as protecting ourselves, the patient, so that we're not over-radiating or just giving too much radiation. But it is very much so safe. We have all kind of standards and specific protocols that make sure that we are keeping the patient and ourselves safe.
Well, I know when I had an X-ray, and again, it wasn't a CT scan, they put this
Yes.
right? And
Yes.
so what is in here that's protecting me from radiation when you do that?
So this is lead. So it's a lead shield, lead apron. They make them in a lot of different sizes. You see them in imaging. This one actually just here. I can actually slip that on you.
Sure.
You just put your hands through there.
Wow, it's really heavy.
It is very heavy, so it's filled with lead. Lead helps block radiation. So with that, we can protect Erin here. Now, typically we wouldn't use this on her for an actual exam because we don't want to block the images. We would use this mainly if a patient's family member
Needed to be next to them in the
correct.
room.
Yes, we can use it for that. And also, if we have younger kids, we want to use lead to try to protect areas that we're not scanning. So,
So if I broke my hand and I'm a little kid, we would want to protect other organs from radiation, only get the hand.
correct.
So
Correct.
no radiation would come here.
Correct. Yep, it helps block that radiation.
Yeah, wow, this is really heavy.
It is
I'm
very
gonna
heavy.
take it off.
in the OR, we have to use this quite often because they'll be using x-rays during surgery. So it can get very heavy. But it's not too bad. You get kind of used to it.
Well, Thomas, thanks for showing us around the room today. I think that we got a really great perspective of all the different types of things you can do. And thanks for joining us
Of
today.
course. Thank you.
Thank you.
Hi, welcome back, students. So now we are still in the imaging department, but we have entered into what they like to call here at Abbott Health the MRI Castle. I have with me here Deanna, and Deanna's going to talk a little bit about her career path here at imaging at Advent Health Celebrations. Deanna.
Good morning.
Good morning.
I am an MRI technologist at Celebration Health. The degree that I have is a bachelor's of science in medical biology with a concentration in radiologic technology. I ended up going to a 4-year school, and it was basically 2 paths that I could take, which was administrative or pre-med. I chose administrative, and I am now the supervisor of MRI at Celebration Health.
Great. And so if I wanted, as a student, and I know I really want to be able to work with patients and do tests involving the MRI, do I have to get a 4-year degree, or can I get something that would be shorter than that?
So there's wonderful programs that we have in Florida here. Valencia has a great program, and it's a 2-year program. In Florida, you do not have to have an RT license, which is a radiologic technologist license, to do MRI. You can go to a school and get a degree just to do magnetic resonance imaging, which is what MRI stands for.
Great. Thank you so much. That helps us, because sometimes students get really confused about what should they do and what are the different areas that they can actually do in education to further their education. So I'm really fascinated. I'm looking at this machine. Can you tell us?
I want to just have everyone turn around and look behind them as the actual MRI castle.
Yes, it's really cool, and so it's really nice that this theme is being placed around, because medical things can be scary sometimes, and so it's a nice calming environment, but can you show us a little bit about this? But I'm really curious. I'm looking on the floor. It's kind of a scary sign. Why is this all here right down here? So students, if you can just aim your camera down, what does this all mean?
So MRI, you have to be very, very careful with regards to patient safety and what they have implanted in their bodies. You right now cannot hear my MRI scanner working, but the magnet never shuts off. It's on 365 days out of the year and 7 days a week. So therefore, with regards to any kind of pacemakers, neurostimulators, any kind of brain or heart surgery, it's very important that we find out what's implanted in the patient before they even pass this huge sign that has all these different things on it that you cannot go in the room with, because believe it or not, at some point in the room, there's a huge magnetic field that if you even have something on your person can get pulled into my magnet. So we always veer on the side of caution here, because an MRI and metal do not get along at all.
Well, what would happen if I were to walk in with like a cell phone?
So if you walk in with your cell phone, it's going to unfortunately erase everything on your cell phone, and it will never be able to work again.
We don't want that to happen.
No, and we kind of joke sometimes because we say that we want to go in with our credit cards because it will also get rid of the magnetic strip, and it doesn't get rid of the debt, it just gets rid of the strip.
You can't get any more debt.
No, exactly.
And we're joking, but it's not really a funny matter. Obviously, we always want to be safe. And so that's why we're even filming. We're filming from the outside to make sure that we don't enter that magnetic field and
Correct.
possibly have something on us that could pull us into the magnet.
Absolutely.
That would be a bad thing.
Absolutely.
All right, so tell us a little bit about, so there's a patient who needs to have an MRI. They come in, you bring them into this. How do they know how does the machine know what it's looking for? How does it do that?
So, us as a technologist, we have to gear the machine to basically take a picture of the area that the patient needs to be looked at. So there's what we call coils. It's basically a camera that we put onto the MRI table for every body part that the patient needs scanned. So for instance, if the patient's having knee pain and they come in with a prescription for their knee, we put a coil or the camera around their knee, and it basically tells the machine and sends a signal to my computer to see the picture of their knee.
Do you have a picture yet? Can you show us what a coil looks like?
I absolutely can.
Okay.
So right now I'm going to be putting on the
And-
coil.
And Deanna, talk really loud now because
so
you're
right
further
now
away.
I'm going to be putting on the coil for the brain. We see a lot of patients with a lot of strokes, so we have to do patients and images of their brain. So now you're also going to see that MRI unit has a fan and a light on. So this way, when we put the patient in, they always feel cool and they don't feel any kind of claustrophobia. And then therefore, whatever body part we're scanning has to be in the middle of the scanner. So when we put the patient in, they're usually in from about the waist up for any body part that we need to scan. And if anything is from the waist down, they're in from the waist down.
Great. So now can we take a look maybe in the control room to see what are those technicians looking at from this way to see into the machine?
Absolutely.
Okay, we're gonna follow you.
Do you want to do continuous or
Yeah, sure.
pause? All right, we're just gonna follow on in.
Hi.
Hello.
So we're now in the control room, and we're looking to see how the technicians look in as a patient is lying on the table and they're going into the MRI. And absolutely all of these computers are not only running the machines, but they can view the patient and see what's happening. And I guess for this particular type of job or any type of job that involves being in this department, the computer skills are pretty important. Would that be right, Deanna?
That is correct. So you will be on the computer most of your day when you're doing MRI. This is just a picture of a patient's brain. We scan in 3-dimensional when it comes to MRI. We cut a patient in 3 different planes. So you have to really train your brain to look in 3 dimensions. So we cut a patient from right to left, which is sagittal. We cut a patient from top to bottom, which is axial. And we cut a patient from front to back, which is a coronal image. So right now, what you're looking at is you're looking at a patient's brain from the coronal plane. If you notice, you can see the patient's eyes here. This is the patient's brain, the patient's nose, and the black area is air. That's the patient's frontal sinus. So there's a lot that's involved with regards to MRI and what the doctor is also going to be looking at. So MRI also helps the doctor in many, many various areas with regards to bleeds, with regards to stroke, with regards to any kind of trauma to a brain or any part of the body. So it's extremely helpful in the diagnosis to many, many patients that we see here at Celebration.
Is MRI used in surgery or pre-surgery? Like, would they look at an MRI scan, do a surgery, and then put them back in to do it? Or is that only, because I know I've seen rad techs in actually surgery suites, part of the surgery. Does that happen with MRI?
So it does happen. In the Orlando campus, they do have an OR MRI suite, and the field is all sterile. right here, what we do now is before surgery, the patient comes here and we do an MRI on them. And usually they go to the OR for planning with regards to brain tumor or a bleed or something. And it goes pretty quickly, but our campus here, we don't have that OR suite. We send any kind of trauma patients like that to South. But it's amazing the technology, what we can do with it.
Great. So this has given us a great look into the different areas. We really appreciate your time, Deanna, and thank you so much for being with us today.
If you guys have any questions, please don't hesitate to contact your professors or myself about getting into this field. I was a radiologic technologist and I did my curriculum and I learned how to do MRI and I stayed here. I've been in the field now. It's going to be since, I don't want to give my age, but a very long time.
A very long time. Well, we're so thankful to have you as a specialist here, and hopefully we never have to see you, but if we do, we know that we're going to be in good hands. Thank you so much for being with us.
Thank you for having me.
Welcome back, students. So we're here today in the radiology department of Advent Health Celebration. I'm with Irving. Irving is a radiological technologist or
Yes.
technician. Is that correct?
Yeah, they're both actually correct.
And how did you get to be here? Like, so how did you start? Did you know that you wanted to go into radiology?
Actually, I studied as many of you that didn't know what to do or what to choose from many options. So I was actually in that stage of confusion, not knowing what I like or what my preferences are. And so my mom was actually that introduced me to X-rays. So I went into the program. It's like a 1 year probation to see if that's something I can go for. And actually, I did like it. And when I started the program, I started with a low grades because I didn't do good in high school, middle school. But after that point, I decided to put all my effort to get high scores and all of my grades. And I did good actually. I passed all my classes. I passed all my tests with high grades. And I liked it so much that actually I continued for multiple bachelors because that's one thing about radiology that is actually the base for many other options that you can actually go for.
Well, that's a great story. So, so someone who maybe, struggling and not knowing what they're going to do, but you found a passion in one particular thing. And so I think we've heard many different stories of different people with their past, and that's a story to tell because students, it's okay if you don't exactly know, but this field has many different areas. So tell us about this room right here. So this is where you get what I like to call an x-ray, right? We're just getting an x-ray.
Yeah, this is one of the x-ray rooms, but it's not a regular room. So we have x-ray rooms that just do x-rays and nothing else. This room is what it's called, it's like a hybrid x-rays that you can do traditional x-rays, so like your bones, to see your bones, your extremities. Also, we can do studies in this room. So we can do what is called fluoroscopy exams.
Fluoroscopy. And so what does that mean?
We remember that from the cardiology department, right?
Oh, that's right.
So yeah, remind us, what is fluoroscopy?
Well, fluoroscopy is actually another radiation source. So the difference is like we see everything live on a monitor, and so as we do the test, we actually were seeing it in display, and we actually can use that to do procedures here in imaging. We also use that in surgery as well.
Oh, so it's live. So you're not taking a picture and someone's looking at those pictures later. You can actually do a procedure and have the ability to see better a doctor who's doing that procedure or in surgery.
Yeah, so like a second set of eyes for the doctor doing either the procedure or the surgery.
Okay. And what's the name? Does this machine have a particular name?
Yeah, I gotta know how this thing works, Irving. This thing looks really cool.
Yes. So it might look like a table for you guys to jump over, but actually it's not. So this is where the patients lay down, and we put the patient here on this table, and we adjust the camera that produces the radiation, and so we can see either the stomach, your small intestine, and whatever anatomy we actually need to see.
So I can see that it has some numbers here. What do these numbers tell us? Is this them taking measurements?
Actually, that's just like a reference on chart. So like it's more like for like distance and the field view that you need to do, and
So
it's
you
like
can-
just
you
more
can-
like a reference.
So you can set it. You can set it to change it.
That is correct. Yes. So it is related to the field view. So that's why you have the light. That's one of them. But
And what about this? What is this here?
that's actually is a LED shield. So we put these in front of us, so we don't wanna get ourselves
We've been
exposed too much.
we've been learning a lot about lead aprons and lead protection here in radiology.
Yes.
Right, so we did that too. So instead of you actually having to put on that whole big vest, you can just stand in front of this and the radiation won't pass through
Yeah.
to protect you.
You can use it individually, or you can use both actually to protect also your head and neck.
Excellent.
So at least this room also has other options, which is we have like a portable
That
unit.
looks like a
So-
gaming system.
Yes, it's like it has a bunch of joystick. You can move the table up and down, tilt it, move the X-ray tube, and so we can get what we need to see.
So would you say for this particular job that you need to have computer skills?
You do actually, but you don't have to have the computer skills at this point. You can also learn as you go.
So you can learn on the job as well.
Yes, that's exactly what happened to me. You can learn as you go because as a part of the program, you get to use the computer in a way that you become a nice independent user.
Specialized.
You
Yeah.
become specialized in that particular field.
That is correct, yes.
Okay. Well, that's great. Well, thanks for showing us around today. We really appreciate it, and thanks for your time, Irving. This is the end of actually our imaging tour here at Advent Health Celebration. And with the help of our tech guru, Mr. Tolliver here, we have successfully done another episode of exploring the departments and what you can do to further your career in health sciences. We hope that you've enjoyed it. Thanks for joining us today from the Career and Technical Education Department.
Please don't forget, like and subscribe because there's a lot more awesome videos coming for season 2. We're going all over the place in Celebration Hospital, seeing some things that you probably might not have considered is an amazing career here in a hospital. Thanks again from Career and Tech Ed.
See you later.
Awesome
See
seeing
you
you.
guys.